Huntington's disease presents several physical symptoms. We describe here the most common ones. It should be noted that an affected person may not necessarily present all of the symptoms described here. Furthermore, the severity and the order of appearance will vary from one person to the next. Chorea. These are involuntary, irregular, and random movements. Those affected cannot control their movements. Early on in the disease, these movements particularly affect the extremities of the body, such as the hands and feet. As the disease gradually progresses, the movements affect the entire body. Chorea may cause injury due to falling, and sleeping difficulties may also arise. The movements increase under stress and anxiety. Fatigue may also be a contributing factor. When chorea causes too many difficulties, it can be reduced with medication. Rigidity or difficulty moving can appear in the advanced stages of the disease. Loss of voluntary movement. The gradual loss of voluntary movement begins early in the disease and progresses over the years. The affected person will have more and more trouble making and maintaining voluntary movements. Here are a few examples. Their facial expressions are reduced. They are clumsier and drop objects. They have less dexterity, and it becomes harder to perform precise movements such as fastening buttons. Balance issues and falling. Gait becomes slower and wider. Chorea may cause falling. It is strongly recommended to follow a program of exercise prescribed by a physical therapist. Dysarthria. Articulation is less and less controlled, and it becomes more difficult to understand the words being pronounced. A speech therapist can help identify solutions and tools to improve the situation. Dysphagia. It becomes difficult to bring food to the mouth, to chew, swallow, and breathe at the same time. The affected person may take in too much food, not chew properly, or choke, even with liquids. A speech therapist and a nutritionist may help find ways to adapt to this problem. Incontinence. Difficulties getting around and decreasing muscle function will contribute to incontinence. Furthermore, the affected person may not always recognize the need to go to the bathroom. The disease may cause weight loss. This is caused by the increased metabolism associated with chorea, the difficulty in planning and making meals, and the need for more time to eat. Furthermore, some affected individuals eat less because they're afraid of choking. Huntington's disease presents several cognitive symptoms. We describe here the most common ones. It should be noted that an affected person may not necessarily present all of the symptoms described here. Furthermore, the severity and the order of appearance will vary from one person to the next. Learning and communication. Affected individuals will have difficulties learning new things. We also notice a slowing of speech and a delay before or between answers. They also have difficulties accessing information they already know. We notice that they need more time to answer a question and that it is difficult for them to organize information. Communication difficulties appear rather early on in the disease and progress until the very end. This is a significant source of frustration and limitation for the affected person as well as for caregivers. Perception problems. Affected individuals have problems recognizing and identifying emotions in others, which may harm social interactions. It becomes difficult to properly estimate time. The person is often late or cannot properly gauge the time needed to carry out an activity. The perception of the body in the space that surrounds it becomes worse. The person may bump into furniture or obstacles more often. The risk of injury increases because affected individuals have problems perceiving pain. For example, they might misjudge the temperature of water and burn themselves. Persons affected with Huntington's are also often unable to recognize changes that affect them physically or that affects their behavior. For example, when asked how they're doing, they'll answer that they are fine despite the obvious symptoms that they're presenting. This is explained by a disturbance in the brain rather than denial. Executive functions. Reasoning speed. The reasoning and thought process are slowed down. Affected individuals need more time to think and to formulate their answers. Cognitive tasks are no longer automatic and need more time and energy. It becomes difficult to maintain attention and to divide it in order to do two things at once. Planning and organization. Affected individuals find it difficult to organize their time and to plan out tasks. For example, they'll have problems keeping their agenda up to date, following a recipe, or filling out forms. Lack of initiative. Families will often say that the affected person sits around all day doing nothing. It is indeed difficult for the person to start an activity or a conversation. They need external stimulation in order to do their activities. Impulsiveness. Affected individuals are impulsive, act without thinking, and may exhibit inappropriate behavior or have inappropriate remarks. Furthermore, they're often incapable of waiting and may become irritable or even ask the same thing over and over. Huntington's disease presents several psychiatric symptoms. We describe here the most common ones. It should be noted that an affected person may not necessarily present all of the symptoms described here. Furthermore, the severity and the order of appearance will vary from one person to the next. Depression. Depression affects about 40% of persons affected with Huntington's disease. Obsessions and compulsions. Obsessions are impulsions or thoughts that are repeated continuously. For example, the fear of germs. Compulsions are repetitions of an action, for example, washing your hands several times per hour. These disorders may create a lot of anxiety, and it's important to discuss these issues with the doctor. Apathy. Affected individuals lose their motivation and their interest for what surrounds them. You can encourage the person to resume their activities by suggesting some, by establishing routines, and by using schedules and calendars. Irritability. The persons affected with Huntington's lose control of the expression and intensity of their emotions, which may lead to episodes during which they suddenly become explosive and angry. This reaction may be triggered by difficulties carrying out an activity or frustration with a situation, but it may also arise for no apparent reason. Perseveration and fixation. The affected individuals may have a fixation and talk about it constantly. For example, asking to go to a specific place or to eat a specific food. You can try redirecting attention towards something else. Another option is to establish routines, such as telling them that they can have a coffee with every meal. Anxiety. Anxiety may appear due to changes in routine or because of difficulty in accomplishing certain tasks. We can reduce the anxiety by reassuring the person, by preparing them to the idea of going out, and by simplifying choices and decisions. Hallucinations. The affected person hears voices or sees things or people who are not there. This symptom is rare. It would be wrong to say that there is no treatment for Huntington's disease. It is true that currently we cannot cure the disease. However, we can treat psychiatric symptoms with medication, which can greatly improve the quality of everyday life.